As a new mother or parent, making decisions about feeding your baby can be challenging, and this can be even more so in the early days of breastfeeding your baby. Sometimes in the early days, the topic of formula may be discussed with you, and I'm going to share a few things for you to think about if this might happen to you. So when we're breastfeeding our babies, we know that not using formula can be really helpful to set up breastfeeding well. However, in certain circumstances, formula or extra milk might be needed. When you're having these discussions with your midwife, it is important that you get all the information you need so you can make the decision that's right for you and your family. Sometimes this is called informed consent. So informed consent is for all families using our maternity services, and that's regardless of immigration status. So what does informed consent sound like when you're making decisions around using formula? So first of all, it's understanding why formula might be needed. So someone needs to explain to you the benefits of using formula at that time. But they also need to explain the risks of using formula as well. So what are the downsides of using formula? We know in the early days it's really important breastfeeding in terms of setting up your long-term milk production, and using formula can interrupt this setting up period when it comes to making milk. So understanding this is really important. If formula is needed for medical reasons, then they should talk about ways to protect your milk supply. So that might include having lots of skin to skin with your baby and starting expressing your milk to give to your baby. Informed consent is about, does the intervention have to happen at this very moment? Can it happen a little bit later? Have you had time to consider what you want to do and what's the most appropriate thing for you to do for your baby? Lastly, if you're having a conversation about introducing formula, but you don't feel that you've had all the information that you need to make that decision, or you feel that the conversation you haven't been involved in, or perhaps you haven't understood all the information that's been shared with you, it's okay to hold off on the decision until you've had that information in a way that you understand and in a way that you can partake in that decision so it feels right for you. So ask for help. There are peer supporters on the ward, and it's okay to ask for someone else to come and talk to you.